Hey, Dr. Bursler from Chiro Health Spine and Disc Center. A problem that I see every single day is people with neck issues, and in the neck you can certainly have neck pain and headaches. Those are common manifestations of a neck problem. But the nerves that come out of the neck go down to the arm and hand, so many people will have symptoms: shoulder, arm, forearm, wrist, hand pain. Sometimes it mimics carpal tunnel, sometimes it'll get diagnosed as cubital tunnel, shoulder pain, things like that. And while all those things can happen and can exist, in my experience, the majority of people that think they have carpal tunnel and things like that, they actually don't. They actually have a problem in the neck, and it affects certain nerves that go to that section of the hand. And then they look at something online, or they go to a doctor of some sort, and they suggest carpal tunnel. And frankly, it's a common misdiagnosis, and I've seen people have surgeries that never should have been happened, and I've seen people get messed up from stuff that never should have happened from a surgery or an incorrect evaluation. So I'm going to go through a few images here to help understand if you're dealing with symptoms like radiating arm pain, if you're dealing with numbness and tingling, forearm pain, elbow pain, wrist pain, or things that is not resolving, that you understand the connection to the neck and the spine. So let's go through a couple of things quickly to get a visual on this. This is an x-ray of a person's neck. Here's the head, here's the jaw and the teeth. These are the vertebrae in the neck. These openings here are, this is a model of the lower back. These aren't the neck vertebrae, but it's the opening around, between the bones, and the nerves actually come out of that openings before they go down to the arm and hand in this case. So you can actually see the nerve on an x-ray. You can see the kind of shape of the opening. And this is like a normal opening, the size and shape. And so the arrows here show, look how the bone is kind of constricting this opening. Instead of it being nice and wide, it's narrow compared to the other ones. Well, what you can't see is there's a nerve in there, and that nerve is coming through that space, and it can be getting compressed, and that can cause symptoms down into the arm or hand. Now you can only see so much on an x-ray because there can be ligament, there can be disc in many cases that are causing the compression, even if it's not the bone, even if the bones look normal. So this is an MRI, not an x-ray, and see a similar phenomenon. You're looking into the opening where the nerves come out. This is the nerve. This is all bone in here, and the white in this area would be kind of fat or buffer zone around the nerve here, and so you should see this nice opening, the nerves in there, and kind of a buffer zone around it. In this case, you see a combination of bone and some disc or ligament kind of crowding that nerve hole. That can certainly produce pain. A lot of times the pain will be worse bending back into the side where the pain is, and especially if that produces arm pain, that's definitely a tell that's coming from the neck. Nice thing with MRI is you can see problems in the disc and other tissues that you can't see on an x-ray. Another indication is many people that say they have their hand going numb or tingling, they think they have carpal tunnel. Maybe they've been to a doctor of some sort and they suggested they had carpal tunnel. If the person only has pain in the wrist and hand, then that would be indicative of carpal tunnel, though there are other tests that could confirm that. But if that person also, say, has forearm pain or elbow pain, maybe they have pain in and around the shoulder blades, as this image here shows. This shows the areas of the neck, and when there's a problem like this, it can produce pain in these sections of the body. And there's not actually a problem where these red areas are. That is a feeling that is emanating from a problem higher in the spine. So what I'm getting at here is if a person doesn't only have symptoms, say, in the hand, but they also have some neck discomfort, maybe they have it around the shoulder blades, possibly forearm, elbow, shoulder pain, things like that, that would be indicative, again, that they have a neck problem causing multiple different symptoms emanating from the same region, as opposed to just one particular problem. Okay. Now, in some cases, a person will have a whole section of the arm or hand that seems to be tingling, numb, or burning, or things like that, and that can happen as well. And oftentimes, a person like that, they'll have a sense of it kind of starting from the neck, or it all occurring at the same time. But certain sections of the skin the feeling of the skin and sensation is controlled by a nerve that comes out of a specific point in the spine. So in this case, a neck problem can produce symptoms the whole way down the arm and the hand down to the fingers, and there's nothing wrong anywhere in the arm, elbow, hand, wrist, hand, fingers, but it's all emanating from the neck. And as a slightly different angle here, this shows as the nerves branch out of the neck, they form these different nerves that supply certain patches of the skin. And so sometimes it's not this real linear, oh, I can feel it from my neck whole way down the arm, that people generally realize is coming from the neck, but they may have a certain patch of their arm that seems to somehow kind of have a deep ache, possibly a numb, tingling sensation to it, things like that. And so it can be it can be like certain sections, like my shoulder blade, and then this section of my arm, and then I get tingling here, but it might not all feel exactly related and all at the same time and very linear, so it can be tough for people to figure out. So if you're dealing with something like this here, point of this is you need to get a proper evaluation of the neck, proper imaging of the neck, and really go to somebody who's a spine specialist instead of only checking downstream, say the wrist or the hand or elbow or something like that, and kind of ignore what is the more common issue, which is the an issue with the neck causing these problems. If you'd like help evaluating this, we'd certainly be happy to do that, and get in contact with us here, and we'll do our best to help you.